Advocacy groups from across Canada are warning Ontario is headed towards privatization. The Ford government is moving ahead with Bill 60, which allows more for-profit clinics to deliver OHIP-covered surgeries. And advocates from other provinces, drawing from their own experiences, say outsourcing surgeries comes at a huge cost.
The government said over and over again that this initiative would increase the number of surgeries performed in Alberta. It did not.
Alberta has perhaps the most concrete evidence after adopting a surgical initiative similar to Ontario's Bill 60 back in 2019. A damning report released today revealed outsourcing surgeries pulled resources away from public hospitals, reduced surgical capacity, and failed to fix long wait times.
The report raised many concerns about unlawful extra billing and two-tiered healthcare.
The Parkland Institute report found wait times worsened for every priority surgical procedure delivered in for-profit clinics, with the exception of cataract surgeries. The number of patients receiving hip surgery within the benchmark declined from 64% in 2019 to 38% in 2022, the second largest drop in Canada. For knee surgeries, the number dropped from 62% to 27%. Total surgeries also declined by 6%, especially in public hospitals where it declined by 12%.
We are losing time, money, and healthcare professionals to really what appears to be a privatization fetish.
The report notes the province has prioritized for-profit surgical delivery rather than system improvement and fully utilizing the nearly 30% of unused public operating room capacity. We're told Ontario's public hospitals are also failing to run their operating rooms at full capacity because of a lack of funding and staff.
We have this OR time. We built it. We paid for it over a century in this province. All of us did. Why would we pay again to rebuild in a private for-profit clinic? In whose interest is this?
Ontario's Bill 60 will allow more OHIP-covered procedures like cataract surgeries, MRI and CT scans, and eventually knee and hip replacements to take place at both not-for-profit and private for-profit clinics. The government has staunchly defended the bill, which passed 1 week ago under fierce criticism.
Bill 60 will actually improve community and surgical centres in the province of Ontario. Why? Because we don't want people having to wait inordinate amount of times for their surgeries.
New data has also emerged in Quebec revealing the government there paid significantly more for medical procedures in for-profit clinics. For instance, cataract surgeries cost an average $800 in hospital and $1,200 in clinic.
Allowing for-profit clinics to do this leads to a two-tiered healthcare system that would actually benefit the wealthy and the healthy at the cost of the most marginalized people who can afford to pay to jump the queue.
The Ford government says 200,000 people are currently waiting for surgeries in this province. A statement from a spokesperson for the Minister of Health today repeating that Bill 60 will put into law that all Ontarians will always have access to insured services with their OHIP card and never their credit card. For City News, I'm Tina Yazdani.